If you're treating FAI syndrome, you might be wasting your time targeting hip rotation range of movement. This new research from Gomes 2025 showed which range of movement measures actually matter for reducing patient symptoms, and there's a sweet spot that you need to know about. They looked at 150 patients with FAI syndrome to find out which hip range of movement measures correlate with symptom severity, and they measured active hip flexion, internal rotation, and external rotation, and they assessed their symptoms with an IHOT 33 symptom subscale. And what did they find? Well, hip flexion range of movement is the most important. Patients with 107 degrees of hip flexion or more were 15 times less likely to have severe symptoms. But more isn't always better. That benefit plateaued at 120 degrees of flexion. More range of movement didn't improve their symptoms. What about hip internal rotation? Just a weak association, and hip external rotation showed no association with symptoms. Now, we know this doesn't prove causation, but it does help us because if we look at screening the hip flexion range of movement at baseline in our FAI patients, if they've got less than 107 degrees, then we need to make that a rehab priority. We can then target that range of 107 to 120 degrees of flexion, and we don't want to waste our time trying to improve flexion range of movement beyond 120 degrees or our rotational range of movement and focus on our other impairments instead.